This story has been developed by staff, service users and carers working in Bristol.
This short animation tells the story of how staff and local service users in South West England work together to improve the delivery of mental health services using digital technology. We hope that by sharing our experiences and the lessons we have learnt, you will be inspired to adopt some of the top tips and consider how co-production and technology could support improved care locally. Our project Joining the Dots was a collaboration between Avon and Wiltshire Mental Health Partnership Trust, Otsuka Health Solutions and Rethink Mental Illness. The aim was to better use the existing information given by service users and support co-produced recovery-based care planning. Our belief was that by enabling service users to be more involved in the information recorded during meetings with their care worker, service users would feel they had a greater ownership of their recovery and well-being and reduce the need to tell their story multiple times. This would hopefully lead to better outcomes. Underpinning this was the core principle that the solution should be built from the ground up rather a top-down approach. Therefore, service users and staff would need to be involved throughout the design and development process. The Care Pathway tool is already having an impact on the style in which healthcare workers and service users engage with each other, improving openness, trust and recovery focus. So here we are today, ready to share our journey and the lessons we've learnt with the hope that you can adopt the ideas locally. So how were staff and service users involved? Right from the start of the project, there was a clear intention to involve service users and staff. People were recruited to design teams and smaller working groups. We developed a weekly meeting with a service user group with the involvement of Rethink Mental Illness as an external facilitator to support a co-productive approach based on the principles of Nesta. The project team took active roles in the design phase, testing, attending monthly project meetings, developed materials for service users and worked on developing a training package. Knowledge was also shared by speaking at a number of conferences. What was the digital solution and how was it developed? From the survey carried out in early 2015, it was clear there was a potential to improve the way service users and healthcare professionals co-produced care. Service users wanted to play a bigger part in their care plan and staff were right in the conversation after the appointments. So what the project team heard was that service users weren't clear on what was being written about them and staff were having to spend time writing their notes after the meeting. The solution was a digital care planning tool that enabled service users and staff to sit alongside one another to jointly develop their care plan and record their conversation in a transparent way. How was this done, I hear you ask? Well, let me tell you. Step 1. Understand what staff and service users need and for what reason. For example, as a service user, I want to see who in my life can help me so that when I feel unwell, I know who to contact. Step 2. Based on this information, we built the prototype for comment from service users and staff. Step 3. Use feedback to improve design and continue process until happy. Step 4. Build first version for release and test. Step 5. Give it to the service users and staff and see how they get on. So what difference has Joining the Dots made to the service users involved on the project team?
It makes you feel that your views and your opinions count and they're being listened to and thought about. I think that's been very uplifting for everybody in the group and it raises your self-esteem because you still do feel that you're worthwhile and somebody cares.
What has gone well and what would we do differently? This has been a steep but exciting learning curve for everyone involved. The recruitment process meant that we had the right people in the team with a diverse range of skills. The chance for service users and staff to input early and often to shape the project. Kept people updated through different methods outside of the core meetings. If we did it again, we would try and create a bigger network of service users with greater diversity. We would try and share the experience amongst a wider group. We would carry out a skills audit early to understand what unknown skills people can bring. If you like the thought of involving staff and service users more in co-production, which we think you should, or if you are interested in developing digital tools to support better healthcare delivery, here are our top tips. Give it a go and collaborate. Better to try and learn than never have tried at all. Involve everyone as equals, and where possible, support people in feeling equal at the start. Develop early prototypes of your innovation and get them into the hands of the people who will be using them to feed back. Respect individuality and play to people's strengths. What next for this project? Well, it's been an exciting journey and the journey will continue. The solution will continue to evolve, always with the core principle of service user and staff involvement at the heart, to enable the co-creation of solutions that will make a difference to people using mental health services in the UK.
We did it.